Hi, Assalamu alaikum. Peace be upon all of you. And I am Gashim Nika. This is Dr.Nasser again, and this is the first episode in one of my vlogs or video blog with carrying the title The Nano Surgeon, where we will talk about microsurgical techniques. I'm a clinical fellow in the transplantation surgery department at Samsung Medical Center. From Seoul City, where I learned that boundaries and limits are artificial constructs, and that the only true limit is your imagination. I was trained in microvascular surgery course for 2 weeks by Professor Choi Kyu-sang, and it was more than rewarding. I will start by the first part, which I will talk about the setup of microsurgery, and then I will move to the second part where I will talk about the mechanics of handling the microsurgical tissue and microsurgical instruments and techniques. And then I will move to the third part where I will talk about an overview of the different microvascular surgical anastomosis. And then to the fourth part where I will start by an end-to-end arterial anastomosis in an interrupted fashion. So before we go to the setup, just brief history about microsurgical techniques. The French surgeon, Professor Alexis Carrel, was the first one to perform a vascular anastomosis. He broke a boundary. Nobody believed that vascular anastomosis are feasible in 1902, and then Jules Jacobson performed the first microvascular surgical anastomosis, and Professor Ackland brought microvascular surgical anastomosis from experimental arena into the clinical arena. And Professor Ackland used to say that the only shortcut you need to take is preparation. And this is what we are going to talk about: setup, how to prepare the setup for microvascular surgery. Definitely the only shortcut you need is preparation in microvascular surgery. I mean, I have seen Professor Choi Kyu-sang perform an end-to-end arterial anastomosis in less than 6 minutes. I timed it. It's not only due to his seniority and his magnificent skills, it's due to preparation. So, the setup. I will talk about the components of the setup and preparation. First, the mental preparation. You have to be prepared mentally for microvascular surgery. It has to be the first thing you do probably in the morning. You have to be relaxed, not at the end of the day or at the end of a long procedure. You have to have a clear mind and have probably a full stomach, or if you are a smoker, probably you should have taken a cigarette or two before starting. You have to be prepared mentally for the procedure, and you shouldn't commit for more than 1 or 2 hours every time. You should take a break and make sure you are in the right mind. And if you want to play relaxing music or Holy Quran, it's up to you. Whatever makes you relaxed. The second thing is the physical preparation, where you have to make sure that you are physically relaxed. You are not in an uncomfortable position. And also we will talk about the instruments. So let's start with the instruments. So definitely you need this is the microsurgical instrument set. You need, starting with the needle holder, you need a needle holder that's fine tip, curved, and locked. The other needle holders are too powerful. They will damage the needle, and they require too much arc of movement. So this is the needle holder, and definitely you need also a locked needle holder, but with the tip that's not as fine as the first one. You need micro scissors, and you need also a knife. You need also jeweler's forceps, a pair of them, very fine one to hold the needle. They can also act as vessel dilator, but they can. You have to be careful. They can cause a lot of damage. Also, straight fine tip jeweler forceps. So this is the instrument that you need. It's always, and we will talk about preparing these instruments in a very comfortable position for the surgeon. Other than the instruments, you need, of course, the stitches. You have 9/0 is definitely the best, especially if you are talking about 2 millimeter vessels. If you are talking about less than 1 millimeter vessel, then 10/0 is your stitch. However, 8/0 and 7/0 also works just fine for a 2 millimeter vessel. And you need, of course, you need a micro scale. This is a 2 millimeter, 2 centimeter micro scale. And you need also an artificial model. The artificial models vary. Artificial vessels, they vary. Of course, there are a lot of artificial models. We'll start by the inanimate dry lab models, and then we'll move to the animate animal lab models in the future episodes. So you have low fidelity. They do not resemble real tissue as it's just latex material, artificial vessel, but they are a good start. And then you have a better fidelity tissue. They are the closest thing to real tissue. You have 2 millimeter microvessels, and you have a 1 millimeter microvessels. With artificial models, they are the best available artificial models. You have also a artificial model tissue that's helpful. You have to dry it with every 20 minutes by spraying, and you need also some pins to fix the tissue. You need to fixate the tissues, so you can. Of course, you need also clamp, double clamp, or single clamp. Unfortunately, I don't have them now. They are coming along the way, and but we will. They are the best. You need to fixate the tissue and to also stop bleeding while you are performing the anastomosis. So that's regarding the instrument. Let's move to the microscope. The microscope, as you can see, you need to learn a few things about the microscope. First, the eyepiece. As you can see, the eyepiece focal distance is 170, and the objective lens, where the focal length is 200 millimeter. You have the eyepiece, you have 12.5 and you have 10. This is a beam splitter for the camera. These knobs are for the inter-eye distance. This is the inter-eye distance. You need to work in a 3D fashion, and if you are going to work in a 3D fashion, you need to make sure that the inter-eye distance is proper for you. This is how to handle it. For me, it always works like just below 65. And these handles grip to adjust the focal distance. This is a camera, Sony camera for beam splitter. You can see here that the microvessel, artificial vessel, and anastomosis in the camera. And you need to know, after adjusting the eye, the inter-eye distance, and after adjusting also the eyepieces lenses to the best acuity, then you need to always modify the distance according to the power. You have the power here, 0.4, and up to then 0.6, then 1, then 2.5. Also we have 1.6. The minimum magnification power here, it's equivalent almost to 4.25, and here 0.6 also about 6 times, 10 times, and at 1.6 17 times, and at 2.5 it's almost 27 times. The way to calculate it is by this is the eyepiece. The way to calculate it is, this is the eyepiece, the focal distance, over the objective lens focal distance. You multiply it by the eyepiece 12.5 by the objective lens magnification power 2.5 and 0.4, the minimum and the maximum. Most of the anastomosis can be done at a power of 4 or 5 times magnification. However, if you need to go to super microsurgery, which is vessels less than 1.5 millimeter, then you need to move to minimum 15 times magnification or even higher. So this is the instrument and the mental preparation. The physical preparation, always you have to use a chair where you can adjust the height of the chair. You have to be relaxed at all times. Your elbow have to be rested, and your wrist also have to be rested. In microsurgery, the movement do not come from the wrist; it comes from the fingertips. So you have to rest your wrist, and you should not stand like this. You have always to be relaxed. So if you are like this, it's after 10 minutes or 15 minutes you'll be tired. You have to be really relaxed. This is the proper positioning. When you hold the instruments, you need to make sure that you do not hold them like this. Resist the temptation to hold the instruments. You have to move them. You have to hold them in a pencil-like grip, like that. The reason is that the movement. If you hold the needle holder like this, you cannot move without moving the wrist. You have to move the wrist to make the pass, and this is too much arc of movement. You will damage tissue. You have to rest your wrist and hold them like a pencil, and just move the fingertip. This fingertip is more than enough. I'm already moving too much. You see, my wrist is not moving. My fingers are only moving, and this movement is too much. I'm crossing the whole operative field. That's how small the operative field. I'm already crossing it from end to end just by moving the finger. So that you have to really be careful and hold it in a pencil-like grip. If you do that, then you will things will be much easier for you. So this is the end of the first part, where I introduced the the idea behind this vlog, and a brief history about microsurgery and how to prepare for microsurgery and the necessary setup for it. That's it. Till next time. Thank you.